Hi, it's Linda from N-Powerment Nursing, application of In the Know, and today we are going to apply the question, why test questions aren't studying. So let's get to our question. Question is, when discussing preconception care with a 28-year-old woman who states she is concerned about her type 1 diabetes impacting her pregnancy, what is the priority education you would provide to her as a healthcare provider? Number one, or A, breastfeeding is an important recommendation to consider. B, infants can be large, leading to difficult labor experiences and a C-section. C, keeping optimal glycemic control is important to prevent congenital anomalies. And D, her insulin needs will increase during the second and third trimester. C is the correct answer in terms of keeping the optimal glycemic control important to prevent congenital anomalies. When you go back up to the stem of the question, you see that you're discussing preconception care with a 28-year-old. This is the key to the answer. Don't confuse preconception care with prenatal care. Preconception means before she's pregnant. So this is a young person who has already type 1 diabetes, who's going and talking to her healthcare provider prior to getting pregnant. And so what is the takeaway from this? What can we take from this question that we could apply to any question? Well, the first thing is being aware about what the word preconception means, right? That means before pregnancy. And also, the answer to this question is talking about the importance of having optimal glycemic control. When your blood sugar is up, and then it's down, and then it's up, and then it's down, it's particularly dangerous for somebody who has type 1 diabetes, because in those first 8 weeks, as the embryo is growing inside of the woman, this is when all the organs are being laid down, when the organs are forming. So they have a higher risk of having congenital anomalies, particularly in those first 8 weeks when the fetus is forming, particularly if they have poor glycemic control. So this is another takeaway that you could apply to any test question, that keeping optimal glycemic control is important to prevent congenital anomalies. The other three answers, we wouldn't really be discussing those with someone trying to get pregnant, okay? Really the key to the correct answer in this question is the word preconception care. For the answer to this question and more, please join us in the future to review our study package. Bye for now.